So today we're going to look at the disorder of schizophrenia in clinical psychology. And for the Edexcel specification, you need to know the symptoms and the features of the disorder, so be able to describe the disorder in either a short answer question or a long answer question. So let's talk firstly about the prevalence and the onset of the disorder. Schizophrenia is one of the more common mental disorders, and it does affect about 1% of the population. Symptoms do usually appear in the early adulthood, so in the early 20s and 30s. It does affect men and women equally, but the symptoms usually appear in men a little bit earlier, so in the early 20s, and in women it's most common in late 20s where the first symptoms appear. About a quarter of the population with schizophrenia do suffer one episode, but they never really recover. And another quarter do not really recover at all and have symptoms for the rest of their lives. Half of the people with schizophrenia can live without treatment and go through periods without symptoms. But symptoms can obviously reoccur as well. So, you do get some people that you probably won't even notice that they've got schizophrenia because they're still living with their families in the community and still got obviously jobs, but they might have mild symptoms of schizophrenia. The prognosis is really about the predicted course for the disorder, and it is difficult to predict really the course of schizophrenia. And approximately 20% of people that are diagnosed with schizophrenia will respond to treatment, but obviously that's only 20%. So imagine the other 80% don't always respond to the medication that is given to them. However, a large number of patients do still remain chronically ill with the disorder, and they will require probably treatment for the rest of their life, along with some different types of interventions, such as CBT, probably for the remainder of their life as well. A little bit about the disorder itself. So people with schizophrenia do have something called an altered perception of reality. In other words, they may see and hear things that don't actually really exist. They may speak in strange ways. They may have a belief that other people are trying to get them or harm them. And they often feel this constant notion of paranoia. In other words, they feel that people are constantly watching them all the time. And this can make it very difficult for them to function in their day-to-day lives if, this paranoia is following them around everywhere they go. It is a chronic disorder, which I mentioned earlier, meaning that once you have it, it doesn't really go away unless it's treated. However, with support, medication, and different types of therapies that are available now, many people with schizophrenia can function and can, like I said, are able to live in the world and the community and have a working job, for example. There is a link here at the bottom which shows a short video of the symptoms of schizophrenia, so to check it out, have a look. So the main symptoms of schizophrenia will break down into the following. So thought insertions, hallucinations, delusions, disordered thinking, and catatonia. Catatonia is just an extra one we're going to talk about, but for your exams, definitely learn the first four. So the first symptom, thought insertion. So thought insertion is where the schizophrenic patient believes that thoughts have been implanted into their head by some sort of external source, such as aliens, or they might believe that somebody else is controlling them, like the FBI, the police. And they're often feeling that their own thoughts are not actually their own, but belong to somebody else. So they constantly feel that somebody's controlling them and putting thoughts into their head. They are still able to, however, distinguish between their own thoughts and those that they think have been inserted by other people. So it's almost like a voice that they hear sometimes, which is obviously not their own voice, and they can identify and recognize that it is not their own voice. The second symptom is hallucinations, and this is a very, very common symptom in schizophrenic patients. And again, it's experienced in the same way as perception of an external stimulus would be, such as hearing or seeing something that is not really there. For example, they may hear voices that are talking to them, so this is obviously auditory stimulation, or even see people in front of them, that's obviously visual. Auditory hallucinations are the most common type of hallucination, schizophrenia, where they'll hear voices telling them to carry out certain actions, certain behaviors. Hence why sometimes schizophrenics can be deemed quite dangerous, because if they are getting auditory hallucinations which are asking them to attack somebody, then that can be obviously a misconception as to their own thinking. So they might actually carry out that behavior. Delusions. So delusions are false beliefs. They're very similar to hallucinations. They're false beliefs that are held by the schizophrenic patient that cannot be changed. And delusions relate to different sort of everyday life events, really, such as believing that your movement is being tracked by the police, or having really bizarre beliefs that aliens are trying to remove your brains. Really, really bizarre ideas and concepts. There are generally 3 types of delusions which you need to know about. So you've got delusions of grandeur or grandiose delusions. And this is where the individual believes that they have special powers, or that they are famous. They may believe that they are the president. They may believe that they are Jesus Christ. They might believe that they've got special healing powers or superpowers, or something like that, or even that they're Superman. Okay. Persecutory delusions. These are individual beliefs that others are out to get them. So a little bit relating to the paranoia that we were talking about earlier. Persecutory delusions is where they may act in a dangerous way because they feel that somebody's out to get them. Referential delusions. These are beliefs when certain language and behaviors they feel are targeted at them. For example, they may believe that when they go out to town or out shopping, that everybody is looking at them, or everybody is talking about them. So they often believe that they're almost like the center of attention. Okay, but again, it's all exaggerated, isn't it, in their own head, in their own mind. Disordered thinking. So disordered thinking is another symptom. This is where the patient's thinking is loosely connected, so almost sort of nonsense thinking, and their language doesn't make sense. Something called word salad, which is almost like a random string of words put together in a sentence that doesn't make sense. And Snyder, 1974, quoted this as an example of a word salad, which he found in one of his patients. I came to the hospital, so they start off with a sentence, to play, gay, way, lay, day, brave, donkey, monkey. So you can see the sentence, it starts off, but then it kind of becomes a bit more jumbled, a bit very disordered. So with schizophrenic language, it can become very disordered, just like that. The person may switch from one topic to another and use very disjointed language. It does become apparent as schizophrenia progresses. In other words, the more severe the schizophrenia, the more disordered the thinking and the language becomes. Schizophrenic patients often seem distracted by things around them, so it's very difficult for you to hold a conversation with them. They may lose their concentrations, get distracted during conversations. Catatonia. So catatonia or catatonic behavior is a very strange and bizarre symptom of schizophrenia because it's characterized by various motor disturbances to do with the muscular movement of the body, and the movement and the behaviors are characterized as abnormal. So catatonic postures are bizarre stationary poses that are maintained for many hours. So they may stand in a certain pose or sit in a certain pose, like the ones that are shown in the pictures, for hours and hours. And also show waxy flexibility. And by waxy flexibility, I mean if someone were to go and move that lady's arm down, her arm would obviously move down and it would obviously remain in that position that you put that position in. Whereas if you raise the other arm again, you would see her arm go up and remain in that same position. So they may sit in bizarre postures and show repetitive movements also, so constantly moving one part of the body for hours and hours, like foot tapping, etc. Now, the positive and the negative symptoms of schizophrenia are sort of divided into two types. So some of the symptoms that we've talked about already can be divided into both positive and negative. So positive symptoms are things that are sort of like added to a person's normal behavior. So delusions is something additional to what a normal person would have. Delusion, so referential hallucinations, are again positive because they're an addition to a normal person's symptoms. Disorganized thinking. So these are all positive symptoms because they are an addition to a person's normal behavior. They are normally thought related, so to do with the cognitions, to do with the mind. So as you can see, delusions, hallucinations, disorganized thinking, these are all positive symptoms, and even catatonia, catatonic behavior. The negative symptoms are characterized by a lack of something. So a normal person is able to speak coherently, whereas a schizophrenic patient has an inability to speak, a loss of emotion also. So this is, the negative symptoms are really like a lack of something, lack of normal behavior. So speech problems, so there's a lack of inability to speak, alogia. A loss of emotions is a feeling of numbness, affective flattening. So in other words, they may show very little emotion or none at all facial expressions when they're talking. Lack of motivation to do things. Avolition. Social withdrawal. This includes breaking off from friendships, family, quitting their jobs, not really being able to socialize with other people. You've also got cognitive deficits, so mental ability, so memory loss, amnesia, attention deficit, so being distracted during a conversation. Planning difficulties include problem thinking about the future. Poor decision making also, which is obviously characterized by the avolition, the lack of motivation. So the negative symptoms are characterized by a lack of a normal behavior. And the positive symptoms are almost like an addition to a normal behavior. Here's just a video which shows schizophrenic patients talking about their own experiences and symptoms. So again, give this one a watch. It's quite a good video which shows people that have really been suffering schizophrenia. And really what I wanted to finish off with was some case studies. So in the next two slides, there are some examples of case studies which you might want to pause and just really have a little discussion and decide, almost like diagnose these case studies and see if you can identify some of the symptoms in these case studies of schizophrenia. So you might want to pause at this point. And there is also another case study. There you go. So if you want to pause and have a go and see if you can apply some of the knowledge that you have learnt about schizophrenic symptoms in both of these case studies.